Hey there. Today let's dive into a fascinating piece of medical history that's making waves again, the rice diet. This isn't your average fad diet. It's actually a groundbreaking treatment that saved lives before we had modern blood pressure medications. Back in the 1940s, when doctors were struggling to treat severe hypertension, something remarkable happened. An innovative treatment called the rice diet program emerged. And it didn't just work, it worked incredibly well. So well, in fact, that researchers today are digitizing thousands of patient records to understand exactly what made it so effective. Now here's where it gets really interesting. We're talking about a massive study involving over 17,000 participants. Their handwritten records and retinal photos were carefully transcribed with amazing accuracy. We're talking 97% precision here. That's some serious attention to detail. But wait until you hear what this diet actually involved. Brace yourself because it's pretty extreme. We're talking about less than 230 milliliters of sodium per day. That's incredibly low compared to our average daily intake. The diet was super high in carbs, making up about 92% of daily calories, with tiny amounts of protein and fat, just 4 or 5% and 2-3% respectively. Picture this. Your daily meals would consist mainly of plain white rice, fruit, and fruit juice. That's it. Sometimes you'd get vitamins or a bit of sugar. And if you were lucky and your health improved, you might get small portions of potatoes, cereals, vegetables, or meat. For most people, this meant about 2,000 calories a day. But if you were dealing with obesity, it could be as low as 800 to 1,000 calories. The results were particularly striking for people with severe hypertension. Of the 1,544 participants who stuck with the program for at least 5 days, nearly 14% had severe high blood pressure, with systolic readings of 180 meter-Hg or higher. This wasn't just a diet, it was a lifeline for people who had no other options. What makes this story so compelling is how something so simple, basically rice and fruit, could have such a powerful impact on health. It's a reminder that sometimes the most effective solutions aren't always the most complicated ones.